I had moments for sure. I don't even know if I told them, but I had moments, in that whole year of 2020 when we were just waiting to like start this all over again. Not that if I should do it, but everything is still shut down and, other things were happening in the world, politically, that was just making everyone really frightened and scared. And so it just made me think like, oh, geez.
Was this the right time?
Yeah, is this the right time to do this? Like, should I wait a whole other year until things start to go better in the world? Or should I just say, it is what it is? I mean, let's just do it. I mean, what are we waiting for,
I think the pandemic has also highlighted really that there is never a perfect time to have a child. So if you're waiting for that perfect time, you're just going to keep waiting because it doesn't exist.
Can you say, "This is Dr. Amanda Zelechoski"?
Why do we have to?
Just try it.
Oh, I can't.
Deep breath. Okay.
This is Dr. Amanda Zelechoski. Lindsay Malloy. Ah!
Now, wait, say Dr. Lindsay Malloy.
Dr. Lindsay Malloy.
No, come back.
This is Dr. Lindsay Malloy. Welcome to the Parenting Podcast.
One more time.
And then after that, can we have a candy flip?
No.
Please, Mommy.
Okay, ready?
Pandemic Parenting Podcast.
Excellent.
Welcome to Season 2 of the Pandemic Parenting Podcast. I'm Dr. Amanda Zelechoski. My co-host, Dr. Lindsay Malloy, is away on a much-deserved research sabbatical, so I'm going to do my best to hold things down for the both of us on this season of the podcast. Back in 2020, Lindsay and I founded Pandemic Parenting in order to share science-based research and to help all who care for kids navigate this challenging time together. Researchers around the world, including Lindsay and myself, have been hard at work researching the impact of COVID-19 on children and families. We've tracked more than 200 of these studies being published, and this season, we're going to discuss many of the direct implications for us parents. So let's dive in. Please note that the information contained in this podcast and on the Pandemic Parenting website are intended for educational purposes only. Nothing discussed in this podcast or provided on the website are intended to be a substitute for professional psychological advice, diagnosis, or treatment. No doctor-patient relationship is formed between the hosts or guests of this podcast and listeners. If you need the qualified advice of a mental health or medical provider, we encourage you to seek one in your area. Generation COVID. It's what many are starting to call the generation of children who are too young to remember what life was like before lockdowns, masks, and nasal swabs. In this episode, we're taking a look at how the pandemic impacted the earliest part of this generation, children born during the pandemic. For those who were pregnant or trying to conceive during the pandemic, all expectations of what their life as new parents would look like shifted. Fertility treatments were paused, doctor's appointments were rescheduled, and hospitals were changing protocols on who could and couldn't be in the maternity ward during labor and delivery. So much was unknown. This is the first part in a two-part series about pregnant and postpartum parents. In next month's episode, we'll discuss the pandemic's impact on childbirth experiences specifically and talk more in depth about the mental health impact on parents. But now, we're going to take a look at some of the research and personal stories of parents' journeys through fertility treatments, pregnancies, and the developmental impact on infants.
Hi, I am Dr. Ezra Aydin. I'm currently a postdoctoral research fellow at Columbia University in the early M3 lab. So that's neuroimmunity, neuroimaging, and neuropsychology. And roughly what I've done for the last decade is look at how one's baby grows, so fetal development, how that can be influenced by the mother, such as smoking, such as exercise, or even your hormones, and how that can all be associated with who they grow up to be as an infant, their movements, their language, their emotions.
Excellent. Thank you. And thank you for joining us for this conversation. So you have been very busy. We've been closely tracking your work with the COCO-PIP study, which stands for COVID in the context of pregnancy, infancy, and parenting. So can you tell us a little bit about that work and how it is you came to be focused on that in your research?
We are a multidisciplinary team of researchers from Cambridge and Oxford with an interest in maternal health, infant development, and public policy. During the pandemic, we just saw our friends and family go through so much. We saw them have children, get pregnant. Obviously, the pandemic meant for a lot of people who were thinking about having children, particularly in the UK, went, right, this is a great time for us to have kids. But I don't think anyone thought about what the pandemic would cause, what restrictions it would have on them being parents. So we saw our friends and family experiencing this, we saw it on the news, and we decided to do what we do best, research. So we set up something called CocoPIP. It's following families. They could join the study at any point between 12 weeks pregnancy, all the way up to 6 months, actually. We didn't want to miss that critical period of development. So we're following families from 12 weeks pregnancy all the way through until their little one's 18 months old. And what we're interested in isn't just the child, so it isn't just your baby. Even though we're looking at their physical growth during pregnancy, we're looking at whether they're reaching certain developmental milestones in terms of their language, their movement. We're also looking at early things such as ADHD or autism. But we're also interested in you as parents in terms of what's it like to be a parent during the pandemic? Has it changed your parenting? Are you receiving the same social support? Has your healthcare been impacted? Has giving birth been impacted? And we're also interested in your finances, your environment, what has changed? Do you see more people? Do you see less people? And unlike most other studies, we wanted to do a mixed methods. So that means that we had these basic questionnaires with yes, no answers, but we also had sections where we just went, right, tell us about your experience. Tell us what's it like to bond with your little one during the pandemic. Is this how you wanted to bond with them? Has something changed? So it's meant that this study, it's been a bit of a TARDIS because it's meant that we don't really know how to put things together. And we've got so much information coming in, which we've adored. But also we hope it will give us a really nice overview of being a parent during the pandemic and growing up during the pandemic. And by growing up, I mean going from 0 to 2 years old.
So my name's Dan Smiley.
I'm Stacy Smiley.
We've been married for 7.5 years. We started off as friends when we first met. So
Yeah, we were just friends.
just friends.
Just like the movie, just friends.
No, not even legitimately just friends. It's just, yeah.
Yeah. And it turned into obviously more fond relationship, and then we started dating, and the rest is history.
Rest is history. And did you always know you wanted to have kids?
Yes. Even separately, like growing up, when I talked to Stacy, she said she always thought that. And even my friends say the same thing about me, like before ultimately finding Stacy, like they always thought I'd be a good dad and stuff like that. So it's never been a second guess, I would say, between the two of us to ever have kids.
Yeah. I saw you attend our pandemic parenting webinar way back when. I had seen, wow, she's here. They're attending the one on babies and having babies in the pandemic. And so that was where I first was like, okay, clue me in a little bit that you might be ready to begin this journey, or we're sort of on this journey. So I wondered if you could tell me a little bit about what your journey to become parents has looked like.
Mm-hmm. So we wanted to have children right away. As soon as we got married, we wanted to have kids. And, unfortunately, it wasn't in our cards right away. We were trying for several years, and then we just didn't let it, consume our mind for quite a bit, because, that can take a toll on you when, it's not happening. And so we continued with, I think it was 3 or 4 years later after we got married, and we started to talk about, what our next options were with like having a baby. Because, we ultimately wanted to have our own baby, biologically. We never took out adoption or fostering out of the card, but we wanted to first go through this journey of trying to do IVF or in vitro, anything like that would help us.
Who were the parents in this study? Tell us a little bit about your sample.
So originally this study started worldwide. We actually have about just under 200 parents from the US. But obviously our main target audience was the United Kingdom. We've got about 2,000 families from the UK. And a lot of our data that we produce over the next few years will focus on the United Kingdom, because I don't know how much everyone knows, but the UK played a bit of the hokey pokey during the pandemic. We had 3 lockdowns, 2 tiered systems over the space of a year. So this was very different than other parts of the world. So as researchers, we didn't feel like we could report all of our data and generalize it to the rest of the world. Because within the UK, we did have periods of social isolation, like whole months where we couldn't see people. We couldn't go for walks outside with other families until they introduced the bubbling system. But at the same time, we did have economic support in the sense that even though we had to sit at home, we'd still receive 80% of our wage from the government. So it was highs and lows.
Yeah. Yeah. So, I mean, a lot of the questions you raised that you were interested in studying are exactly the ones we're hearing from parents that they're worried about, right? You know, what does this look like for my infant's early development? How did this impact me, which then in turn impacted my baby in utero? So yeah, talk us through a bit of, you know, some of the main takeaways and things that you found so far.
It's quite interesting that you say that, because whenever people used to talk about child development, they think, okay, 5 years old plus or 2-year-old plus. And now we're realizing as researchers, clinicians, parents, that the first 1,000 days, so like from conception to 2 years of age, are arguably the most critical and influential, because it's during this time that our brains develop more quickly than any other period of our lives. And they adapt and mold to the environment, shaping the person we will later become. So this is why we decided we really need to study this from pregnancy and see about the influence, not only on the child, but on the parents. And you've got all these reports on the amount of stress and anxiety that it caused these parents, because this is probably one of the biggest things they'll go through. It's a journey. It takes a village to raise a child. And all of a sudden you're told, get in, close the doors, don't let anyone see, like hide. And all mums want to do is show off the bump, is chat with other mums. How are you getting on? That antenatal support that they receive, a lot of mums have said how critical it was, and not having that really did cause this isolation. They just didn't know what to do. As a team, we initially thought it was most important to get out parents' voices. We wanted to give them a voice. So our first 2 papers that we brought out have focused on healthcare. Did parents receive the healthcare support that they wanted, expected, and what it was like to give birth during a pandemic? Because I hope we never go through anything like this again, but it has definitely shown that as a society, not just related to the UK government, but as a society, we need to have things in place, because overwhelmingly, women felt like their voices were stripped and they had no control. And when you already have little to no control during pregnancy, you have this little one growing inside of you. You need to be able to have a voice. You need to be able to make a choice. So consistently, we'd hear that parents were anxious. They didn't want to attend meetings. For example, as a first-time mother, I feel like I haven't been very well supported. I have no idea about anything that would usually be covered in antenatal classes, because a lot of antenatal classes were originally taken offline, so you could do them virtually. But obviously, what if your hospital couldn't support that? So a lot of mothers went without any of this extra support.
Yeah, or you're in a rural community without access to technology. Absolutely.
And then another thing that we heard a lot about, which I think a lot of women all over the world experienced, was not having their partners there. This whole one in, one out, not having support, because it makes a whole lot of difference having your partner, sharing in that experience with your partner, finding out the sex of your baby, or seeing them for the first time on the ultrasound scan. For example, a mother said that she was disappointed that partners have been excluded from all aspects of routine appointments too. I feel so very alone on the journey. That is a part that mothers can share with their other halves. Because as mums, we get to feel this baby growing inside of us, but your partner doesn't so much get that kind of connection. So it's quite important that they are able to develop this during the appointments by seeing the baby, etc.
Yeah. Yeah. And that was a loss that many did not get to experience, right? But had anticipated, this is something you always hear you'll get to do and get to have through your journey.
Yeah. I think this is something that we've consistently heard throughout the entire pandemic, is that the healthcare appointments, women had more of a negative experience, or expectant mothers had more of a negative experience. But at the same time, I think the healthcare system was not ready for what they were getting. No one knew that this was going to happen. So it's very important that we just listen to what is being said, take note of what hundreds and thousands of women have been screaming since the start of the pandemic, and put guidelines in place.
Luckily, Dan was able to come with me to, I would say most of my appointments.
Yeah, I would say 90% of
The
them for
important
sure.
ones, the ones where he needs to be there for blood work, et cetera, he didn't need to, but he was able to come to those. And I know I was talking to some of my coworkers who were going through something similar, and they weren't able to bring their husband or their spouse into the room with them for the big moments of, transfer and retrievals. And so I was happy that our doctor's office allowed that.
Especially the transfer itself.
Mhm.
That's an important thing to be a part of. And I am ever so grateful to the doctor's office for not even second guessing it. And they did it with all the husbands too, from what I could gather. On top of it, they were very smart on everything with COVID,
Mhm.
but being a part of that it's an experience. I can for sure say,
Mhm.
I don't know how else to describe it, but it was the most surreal thing to be a part of.
Mhm.
And the fact that I could be there was even more of a reason to be speechless to. I don't want my wife to be there by herself having this happen when I should be there too.
Mhm.
This is an important part in our lives and everything. So yeah, the doctor's office they were very, very great in every aspect of how they made us not only feel comfortable, but be a part of every big thing that we had to be a part of.
I'm going to go ahead and start.
Nope.
No? Okay. Well, I am Anthony Perillo. I am an associate professor in the psychology department at Indiana University of Pennsylvania. In this family, I am dad. And right now we've got our little daughter here who wanted to make a cameo appearance. And now she wants to go over to mom.
Hi, I'm Jen Perillo. I'm also an associate professor at Indiana University of Pennsylvania, and I am mom.
So thank you both for joining us for this conversation. I'm just really excited to hear your perspectives. One of the reasons we really wanted to talk to you in particular is because you bring both lenses, right? You're new parents yourselves, but you've also been immersed in psychological science for many years. And, these are the things we have been working hard to bring together for the last couple of years in the pandemic parenting work we've been doing. So the way I sort of knew that you were embarking on this journey, right, was having seen your name pop up in one of our webinars very early on, specifically focused on pandemic babies. So it clued me in the Perillos might be beginning this journey themselves. How exciting. And, or what a journey, right? The journey isn't always very exciting. It's full of ups and downs for lots of people. And so I wondered if you would be willing to share a bit about what your journey to become Isabella's parents has looked like.
Sure. Well, like you said, kind of up and downs. When we made the decision to become parents, obviously had to see the doctor first before embarking on that journey. And it took over a year for me to get an appointment with my doctor because of the pandemic. So that was an interesting start to that whole part of the process, for sure.
Yeah. I mean, we've been married for quite a while before having kids. I mean, 13 years before having Isabella here. And we made the decision not too long before the pandemic started. It didn't throw a curveball necessarily in our decision, but we wanted to check in and have additional conversations about timing and readiness and all that. And then, of course, one of the indirect things from the pandemic was, a lot of complications around jobs and all that. So right around the time that we not only decided we wanted to try to have a child, but then also that Jen got a doctor's appointment and that we could actually go through the process, was that our university started cutting positions. And right around the time, maybe literally weeks before we were going to start trying, we both got notices that our jobs were being cut at the end of the year. we were talking about this, that in one sense, it felt like that was going to complicate things, but in another sense, it was kind of freeing in a way, because I think a lot of people have related to this idea around the pandemic. It's opened eyes in terms of what kind of life that you want or what kind of life you have isn't necessarily the one that you need to have. And when we had kind of these letters that were saying your plans might radically change right now, we had to start planning what the next steps of our life were going to be. That allowed us to less focus on fitting our life around the job that we had right now and just focusing more on primarily what did we want for our lives. So in a way, it actually clarified and helped us plan around centering family first and foremost with whatever the next steps were going to be. And then those letters were ultimately rejected. We were able to keep our jobs, but that was able to just kind of give us some reassurance of, the decisions that we've made. We're able to prioritize that and fit our lives around that.
We started looking into IVF.
Real quick, in vitro fertilization, or IVF, is a fertility treatment where an egg is removed from a woman's ovaries and fertilized with sperm in a lab. The fertilized egg, called an embryo, is then returned to the woman's womb to grow and develop. Stacey also mentions the term IUI, which is intrauterine insemination, a fertility treatment that involves directly inserting sperm into a woman's uterus around the time her ovary is likely to release an egg to be fertilized.
We didn't do IUI right away because we wanted, because of my age and the time that it could have taken to get pregnant, we went straight for it. And that was in 2019 when we started to seek research and talk to doctors. And then February of 2020, we were like ready to go. We were talking, okay, in the next 2 to 3 months, this is going to happen. And then the pandemic hit. And so, everything was only, elective, couldn't,
Yeah, they shut down everything as far as if you hadn't already been in the process of it, they weren't going to work with you until, things opened up.
We didn't even start. It was just conversation. So because of that, they had to put us on the back burner for a little bit. And so that was really disappointing.
So let's pause right there just for a second.
Sure.
So your timing really sucked, it sounds like.
Yeah. To say the least. Yeah.
Okay. So when you learned that, right, pandemic's hitting, in March of 2020, right as you were about to step wholeheartedly kind of into this fertility journey, what was that like for you both?
Defeating, I would say, for sure. With the struggles that we've had over the years, this was like our time to quote unquote shine, if you will, to, really move forward with the process and everything. And especially when Stacey got that call from the doctor's office saying, hey, we've got to put you on hold. Then it was like, well, how long, and especially with the pandemic just beginning and everybody saying, oh, this will only be 3 months, blah, blah, blah. As time continued, it was more and more defeating, I would say, at least for myself in particular.
Yeah, it was frustrating just because we, were in this place, we were ready to go, and we didn't know how long it would take for them to say, yes, we can proceed and move forward. I was able to officially start the process of IVF in early 2021. So about March, we were, going through adjustments of medication for myself and getting me to a place where we could do all of those steps.
Testing for both to make sure that, we're healthy and can obviously move forward with everything.
Yeah, everything that goes into it. So we were ready to go. And again, with the pandemic, it was like every month, they were going to, they didn't know if they were going to shut down again. Like we just kept hearing that. We kept hearing, do it now because, it's going to spike again. And so it's like every time we heard it's going to spike again or the numbers are going to go up, we were so afraid that meant that we would be back to square one. And so we made sure, as things were ever changing, that we were going to make this happen. So May of 2021, we were able to start everything with the process, and luckily nothing shut down.
Overall, parents reported a lot of negative feelings, a lot of feelings of sadness, loneliness, and isolation, and anxiety. But on the other hand, you can see a little silver lining coming through, where you'll have instances of a mother, for example, breaking down and saying she was extremely upset, but the nurse consoling her. And for once in that moment, she didn't feel so alone. Or you'll have hospitals setting up whole Facebook groups or WhatsApp groups and constantly communicating, so they knew moment by moment what was happening. Could partners come in? Could they not? So overall, it just seems to be that whilst there were these anxiety and loneliness and isolation, that could all be broken by communication, by being kind. And people were there and willing to listen. But I guess that was all lost in the pandemic, with everyone running around, no one really knowing what's going on. Because this is stuff that we normally do when a mum's giving birth.
Yeah.
It's nothing new.
Yeah, but being able to sort of rapidly mobilize and increase communication where you could seems to be really key, you know, in the midst of so much uncertainty on a lot of levels.
I was originally seeing a doctor's practice that had you visit a different doctor every time. And my very first appointment, I asked the doctor about the vaccine, and he blew off my question. And after my appointment, went outside the room and started making fun of me for asking about it to the rest of the people in the office. And I could obviously hear him. And then my second appointment was with a different doctor who absolutely refused to answer a single question about the vaccine, just refused to talk about it, and said that their patients had to make the decision entirely on their own, and they would not provide any information or guidance at all.
Wow.
So at that point, I went to a new doctor's office.
I was just going to say, please tell me the story ends the way I hope it. Okay.
But of course, we live in a tiny town, so that meant a 45-minute drive to go to a new practice. So that was, you know, just another kind of layer on top of all of that. But yeah, so that was an interesting part of the whole thing, was kind of feeling like trying to find doctors that were willing to talk about it at all, much less offer support about kind of those decisions around being pregnant during a pandemic.
Which of course is the guidance, right? Like from all these major organizations is, you know, here's the information we have, but talk with your doctor about, and then you tried.
Yes.
Right.
Yeah. At that point, the ACOG had official guidance that you were supposed to talk to your doctor.
The ACOG is the American College of Obstetricians and Gynecologists.
And they weren't yet recommending the vaccine, but they were saying you should talk to your doctor, and they refused. And yeah, so that was an interesting piece of the whole thing.
Mm-hmm.
I mean, I think the pandemic has also highlighted really that there is never a perfect time to have a child. So if you're waiting for that perfect time, you're just going to keep waiting because it doesn't exist.
And I think one of the things that I've always sort of tried to keep in mind, you know, obviously there's been a lot of concern, for example, about children's development being delayed by the pandemic, them not being able to get as many experiences, et cetera, because of shutdowns, et cetera. And the vast literature that talks about how resilient children are and how they're going to bounce back and they're going, you know, yes, we can do things to facilitate their growth and development. There are things that we absolutely should do, but not facing parenthood through a lens of fear, I think, is really important. And recognizing, yeah, you're going to make mistakes. Yes, things are going to go wrong. Your child or children will most likely be okay, you know, and, you know, you just have to do the best that you can. And I think, you know, just repeating that mantra of, you know, there's all this research that says kids can get through things is very helpful as a new parent.
Embrace that you won't know everything and that you'll make a mistake.
Yes. Even as scientists who can look at all of the developmental literature, like there's a lot out there. There's a lot of conflicting stuff out there. That's okay. You will be okay.
Yeah. And that, like, one of my saving graces as a parent is like, we get do-overs. Like, it's okay to screw up in this moment, you know, and then come back to that child later on and say, you know, hey, let's revisit that. You know, I think I missed maybe that you were trying to tell me something that was really important to you or something along those lines. So we get lots of opportunities to screw up for sure, but also, you know, to repair, to do well, to try again next time.
At Pandemic Parenting, we're committed to making science-based resources immediately available to parents and caregivers. One of our 2022 goals is to ensure that vulnerable families have better access to our resources. Since January, our team has been creating transcripts of our growing catalog of audio resources for parents who are deaf, hard of hearing, or prefer to learn through reading. Our next milestone is to translate these resources into Spanish. Your unrestricted donation will help break down language barriers to get our resources into the hands of Spanish-speaking parents and caregivers. This is where we can use your help. Between Mother's Day on May 8th and Father's Day on June 19th, we have a goal to raise $5,000 to fund our translation project. The funds raised will allow us to hire professional English to Spanish translators with specific expertise in medical and psychological resource translation. Your donation of any size will go a long way in helping us reach our goal. Go to www.pandemic-parent.org/support or follow the link in our show notes to learn more and donate. Thank you for supporting Pandemic Parenting so we can continue to support families.
In our next episode, we'll dive more into the specific impact of the pandemic on the childbirth experience and take a closer look at parent mental health, including postpartum depression and anxiety. For now, we turn to after childbirth. How has the pandemic impacted infant development and the support parents received from their communities? So what about, and I don't know if you guys have looked at this yet in your data, but, what about the impacts on the actual infant's development? I know that's been a big worry, and sort of, hearing you talk about the science, we know that, how important those first weeks, months, and first 2 years are. I always found that, as a mom, really equally, I guess, scary and reassuring. Like, oh, wow, I really need to figure this out and get it right in the first, weeks, months, and first 2 years. But also like, okay, that's a cumulative effect. And so if I make a mistake in, one day or, over a period of time, that doesn't necessarily mean negative developmental experiences or the demise of my infant's well-being. But so, yeah, I'm wondering though, because I know that's something that has been so much on the hearts and minds of new parents is what are going to be the detrimental effects on our newborns and our infants because of the pandemic situation?
I love your use of the word demise. That's such a loaded word. And I don't think that there's any way that you can influence your child's development based on 1 or 2 days of when you've just not been feeling up to it. Like, you can't answer all the whys. Sometimes you just got to be like, just because.
Right. But like, my goodness, that's what keeps us up at night, is like, oh my gosh, did I say all 450 words that I should have to my child today? And did I, connect in these ways? And you're just, we can obsess over those things. And then there were just so many more things to worry about anyway in the last few years.
No, I agree. It's been quite interesting, actually. So there's been a lot of work that's come out of the US saying that it has affected their child's development. So they haven't reached certain milestones they'd be expected to. So it's not that they're not developing, they're just developing a little bit slower. So they might be crawling a little bit later or walking a little bit later, but nothing too like, oh God, this is a huge problem. We're currently working on UK data, and I create this distinction because our lockdown scenarios were a lot different, as I mentioned. So you had 2 parents that could be at home who were receiving their pay regardless of whether they were working virtually or not. So preliminary findings that we're looking at might actually suggest that these little ones are doing quite all right because they got a lot more FaceTime with mum, a lot of FaceTime with their partner or whoever is socializing. In some instances, we even had parents move into the house. Yeah. So you have this hybrid family. So we are currently shifting through that data. But for us, we're finding that actually this might have been okay because a lot of parents were so hypervigilant, I need to entertain my child. I need to make sure that my child's doing okay. Yeah. That they're going out of their way to make sure their child was socializing, whether that be over Zoom, whether that be with them one-on-one for, an hour or 2 a day. So they're already receiving a lot more face-to-face or FaceTime than they would have normally. And they've also got the second parent at home, which has meant the world because it's also meant that the primary caregiver can have those breaks, can basically just pass off child and go, I need a shower, please just let me go, which has been incredible. We continue to work from home for about a year. Some offices still haven't opened in the UK. So a lot of families have still got both parents at home sharing childcare duties.
So that's really interesting, right? That, there are all these worries about what is my infant missing in terms of social connection and the ways that I usually would be around other people. But it sounds like you're starting to find in some of the research that actually there was more connection because parents were home, because we were all sort of locked up indoors for various phases of this. So I think that's really interesting. What about the worries people have, though, about their infants and young children being around other kids, like that socialization?
Obviously, there are many anecdotes floating around, such as every man with a face mask has become granddad, or other children are scary because they don't look like anything I've seen before. And we've heard that quite a lot from parents as they started coming back into the lab, when we've started talking to them again, seeing how they're getting on. Socially, it would be interesting to see where they end up. We are looking at their social and emotional development, which could be where we see some changes. Once again, it's not a negative, it's not a positive thing, but this is why it's important that we remember this is a COVID generation. These little ones have grown up in a very different set of norms than any other child has done before, on this grand scale, of course. So we've just got to be mindful of it. And as researchers, I feel like it's up to us to shed light on it so that that can be passed up the food chain to policymakers, to teachers. But at the same time, that means our research has to be understandable.
Yeah. Yeah. And starting to think about things like developmental norms, will those look different for this generation COVID, as you mentioned, and what will those metrics be? Might we look at them a bit differently? Will there be adjustments that need to be made? Yeah. When you have such a change on a global and sort of long-term scale, like we've been seeing.
But it's also mentioned a lot of times in the research, those developmental norms were based on specific countries, were based on specific ethnicities or groups of people, and they're not entirely applicable to every person. So I think it's just important that parents, you guys have a sixth sense. You know when something's not quite right. And obviously the pandemic has just alleviated stress and anxiety and ability to handle everything, including yourself and what's going on. It's that loss of control, loss of knowing what's going on, and loss of having a voice, if that makes sense. So I think quite rightly parents are stressed, but at the end of the day, we still have limited to no idea what's really going to be the long-term impact of what's happened. But right now, it will be all right. I'd like to say I could be entirely wrong, but from what we're seeing, little ones adapt at an incredible pace. They are like plasticine or Play-Doh. It's incredible. One day they might be scared of the tomato, and the next day it will be their favorite thing in the world. Mm-hmm. So all we've said to parents is be kind to yourself and be kind to your children, let them explore and just be patient.
Yeah. And listening to that gut instinct around, when it's time to advocate, whether that's with your pediatrician or at your child's school or childcare facility around some of these questions or concerns you might have. I mean, especially for new parents who really don't have anything to compare it to. You're already sort of watching, are they doing things on time? According to, what I've read or been told, but then knowing, like, again, those metrics might have shifted a bit, or we're still trying to understand and learn how they might have shifted, given the pandemic complexity. You often hear about when you have a baby, the way your sort of village swoops in, your family, your community, your friends. Are there ways you felt like that looked different because of having a baby or going through this journey at the time that you did? So talk a little bit about that.
Yeah. The first thing came to mind was, I want everyone to come over, I don't want everyone to come over, but you know what I mean? Like, I want everyone to meet her, but then, I have to be the bad person and say, you're gonna have to wait a little bit, or when you do come over, you have to wear a mask. For some of my friends and family that I know are more social, or their jobs require them to be out more, more face-to-face with people, I would require we require them to take a COVID test before they met her, because we couldn't take a chance with how far we've come, with the fact that neither one of us, knock on wood, got sick during it. We're like, we cannot have this happen now, especially with her this little.
Especially with people always willing to just, give any type of help that they wanted to give, when we got home. And it's just like, yeah, I'd love to take you up on that, but,
right.
And that's frustrating in itself. And, we've had friends that have understood some of our struggles over the years trying to have children. So like not having them see her right away is heartbreaking. It's heartbreaking that, some of our family still hasn't obviously, met her yet. And that's obviously the nature of the pandemic right now. And that's hard,
Yeah.
Maybe the indirect unsung hero of support too here is our department. In terms of both of us working in the same department, being open with them about when we were expecting, and then having our chair alternate schedules for us where one of us could be at home on all days. So there was never a time when we were booked at the same time. That was a huge support in both of us, knowing that if we needed to do something for our job or otherwise, that the other one could easily tag in, or just knew that it was their time to just really take primary care duties that day or during that time period. So having that flexibility by supportive department was really important. You can't do this on your own. A lot of this comes down to thinking about who you're going to be counting on, and whether that's, includes family, friends, support at work, your partner, whoever it is. Thinking about who you're going to be counting on and just communicating with them and being as honest as possible, thinking about what you need, thinking about what you don't know, and being clear, understanding, supportive, I think has helped us a lot.
It takes a village to raise a child. And I hope that families realize you are not alone in your village. This village was the size of the world. Everyone was experiencing something similar. Everyone was going through these moments of anxiety, aloneness, unsure what they're doing. And now you've got a little one that you're constantly worried about. You don't know if you did the right thing, if you did the wrong thing. Honestly, let's just keep talking. Over the next few years, a lot of stuff will come out. You'll find out a lot of things, a lot of information will be pumped at you. So do keep in mind that when you do see something that might be a little scary, i.e., COVID meant that a lot of children are now stunted in their emotional development. Remember, that was done on a specific group of children. It might not apply to your little one. Trust your gut. You've done the best that you can. Just keep on going. And us as researchers, we will try and give you an overall picture using larger samples, using more of a variety of people from all over the world to help you and your little one reach their full potential. We all know about Generation COVID. We are all here to help. Keep talking to us.
What a beautiful ending. Oh my goodness. I'm like tearing up. Good Lord. Did you script that? That was amazing.
Well, now you know how I feel shifting through all of this data from mothers and grandmothers and family members from the last few years. It has always been very tearful.
This has been an episode of the Pandemic Parenting Podcast. We'd love to connect with you via email or on social media. Follow the links in our show notes or look for our blue and yellow logo when you search Pandemic Parenting on Twitter, Facebook, Instagram, LinkedIn, YouTube, or TikTok. And this podcast isn't all we do. Pandemic Parenting is a 501c3 nonprofit providing free science-based resources for parents and all who care for children while navigating the COVID-19 pandemic. To learn more about our organization and access our extensive library of webinars, videos, blogs, and more, visit www.pandemic-parent.org. pandemic-parent.org. This season of the podcast is produced by Victoria Bruick, Carmen Vincent, and myself, Dr. Amanda Zelechoski, with strategic support from Dr. Lindsay Malloy and Pandemic Parenting's Executive Director, Jennifer Valentine. Many thanks to the Pandemic Parenting team for their work in making this show happen, including Miranda Dauphiny, Lydia Lang, Julianne Matthews, Mark Snow, and Paula Sillers. If you want to support the work of Pandemic Parenting, you can do so in a few ways. You can leave us a 5-star rating and review on Apple or Spotify. You can donate to our nonprofit at www.pandemic-parent.org/support. And lastly, and most importantly, you can share this episode with parents and caregivers in your communities. Until next time, thanks for listening, and please give yourself some grace today.